I remember in my initial consultation for an autism evaluation, the provider said to me that I made really good eye contact, implying that I made really good eye contact for being an autistic person. And I had to explain that even though it can be difficult for me at times to make eye contact, that I understand it's an expectation and something that makes other people comfortable and feel listened to. So, as part of the masking that I've experienced, over time, is making myself do that. So I found that it's surprising that actually there's a lot of the same misconceptions even within the mental health care field when working with providers. And even if they do have an understanding of autism to some degree, a lot of times that tends to be focused on children rather than adults. And some other challenges include the difficulty to get evaluated for autism. The waiting process can be really lengthy, upwards of a year in some areas, and on average, that the cost is about $2,000. And I've also experienced some of the providers expecting payment in full upfront, despite even if insurance had approved it, and that can be quite the barrier. I think it's important for mental health providers to realize that treatment for autism does need to be differentiated at times. I have experienced that there are quite a few mental health providers that aren't necessarily aware that of research by like Raymaker on autistic burnout, pointing out that while there's some overlap between depression and autistic burnout, that they, some treatment like behavioral activation can actually make autistic burnout worse. So I think it's important that providers are doing their best to try and keep up on recent research to see what we're learning. And then another barrier to service is being able to find treatment options near you. So once an adult is diagnosed with autism, then they face a very huge up battle of trying to navigate what services exist for autistic adults in their area. I know where I live in a smaller area, there really isn't much, other than maybe if someone needs to have direct care staff living with them to help them, or not living with them, but staying with them to help them be independent. Um, and that oftentimes when people are trying to access other services after a late diagnosis, that they're then faced with having to justify why now they need these services, but they didn't have them before.